Osteosarcoma, also known as bone cancer, by Kwiedrich. Do you know someone who is currently battling cancer? If not, chances are someone you know does. Cancer is the second leading cause of death in the United States. 1 in 4 people will be diagnosed with cancer sometime in their lives. In 2009, the overall cost of cancer was $216.6 billion. How normal body cells work. The body is made up of trillions of living cells. Normal body cells grow and divide to make new cells. During the early years of a person's life, normal cells divide faster to allow the person to grow. After the person becomes an adult, most cells divide only to replace worn out or dying cells or to repair injuries. Cancer starts when cells in a part of the body start to grow out of control. Cancer cell growth is different from normal cell growth. Instead of dying, cancer cells continue to grow and form new abnormal cells. Cancer cells can also invade other tissues, something that normal cells cannot do. Growing out of control and invading other tissues are what makes a cell a cancerous cell. These pictures show normal cells on the left and cancerous cells on the right. What is osteosarcoma? Osteosarcoma is a type of cancer that starts in the bone and can spread quickly. There are many bones in the human body and they all serve a certain purpose. The bones in our bodies help to support internal organs and produce and store cells in our bone marrow. Approximately 800 new cases of osteosarcoma are reported each year in the United States. Of these cases, 400 are in children and teens. More than 60% of children with cancer are treated as part of a clinical trial due to the fact that cancer in children is so uncommon. The exact cause of osteosarcoma is unknown, but scientists state that it could be inherited through genes or it could be acquired after birth. Scientists also state that certain changes in DNA can often cause cells to become cancerous. Osteosarcoma occurs in the long bones around the knee, the upper and lower leg, thigh bone, upper arm bone, or any bone in the body, including the pelvis, shoulder, and skull. It also could spread to other parts of the body such as the tissues, tendons, muscles, organs, and throughout the bloodstream. Tumors are classified into 3 types: high-grade, intermediate, and low-grade. High-grade tumors are the fastest growing tumors and often spread throughout the body. If osteosarcoma spreads to other parts of the body, including the tissue, bloodstream, and organs, it cannot be cured as easily, if at all. Symptoms and side effects can include pain in the affected area of the bone and has been known to increase with activity. Swelling and lumps or masses in the affected area may also be present. Osteosarcoma can also cause weakened bones, which can easily cause fractures or breaks in the bones. Treatment and side effects for osteosarcoma include chemotherapy, which is using drugs to destroy the cancer cells by stopping the cell's ability to grow and divide. This is usually given through an IV in the vein or a pill to be swallowed. Depending on the severity of the cancer, doctors may use one medication or try a combination of medications at once. Chemotherapy is often given before surgery to reduce the tumor size and is also given after surgery to destroy any tumor cells that could potentially still be in the body. Radiation therapy is used for the use of high-energy X-rays or other particles to destroy the cancerous cells. This is not used as often as other treatments for osteosarcoma and is typically only used when doctors are trying to avoid amputation of an arm or leg. Surgery is used as often as possible to help patients keep their limbs while removing the cancerous tumors. Many patients want to return to their normal lives after treatment and seek as many different treatment options as possible to beat the disease. Side effects of all treatments can include infertility, hearing loss, heart failure, kidney damage, and memory impairment. When treated appropriately, patients with high-grade osteosarcoma in one location have a survival rate of about 70%. As you can see, cancer can affect anyone at any time in our lives. It does not discriminate and can change people's lives instantly. Early treatment is necessary in fighting the disease to possibly prevent any further spreading. By bringing awareness to the different types of cancer, we are a step closer to finding the cure that we so desperately need.